All right, welcome to The Explainer. Today we're diving into restorative dentistry, what it is, what it actually does, and why it's so fundamental for your long-term dental health. We're going to be using some great info from the Las Vegas Dental Group to help us break it all down. So let's get right into it. It's a question nobody really wants to think about. But hey, it happens to a lot of us. Maybe a cracked tooth from something you bit into, or a gap where a tooth used to be. It's more than just annoying, right? It can mess with how you eat, how you talk, even how you feel. And that is exactly where restorative dentistry steps in. So, when a regular cleaning just isn't going to cut it, what's the actual goal? Well, it all comes down to one simple but powerful idea: restoration. So, what are we really talking about here? At its heart, restorative dentistry is all about two things: health and function. And look, this goes way beyond just making your teeth look pretty. We're talking about the real jobs your teeth have to do, like chewing your food right, and even supporting the structure of your face. And here's a really key point. This isn't just about patching up old damage. It's about playing defense for the future. Think of it this way. Fixing a small crack today helps you avoid a much bigger, more painful, and probably more expensive problem down the road. Okay, so this brings us to something that trips a lot of people up. What's the difference between restorative and cosmetic dentistry? Is it about function, how your teeth work, or is it about form, how they look? The main difference is really the primary goal. Restorative work is something you need for your health. It's medically necessary to fix problems with function. Cosmetic work, on the other hand, is elective. It's something you might want to improve how your teeth look. But as you're about to see, the lines between them can get pretty blurry. And here's the thing. It's not really an either-or choice anymore. The best modern dentistry actually blends the two together. The idea is that the healthiest smile is also a beautiful one. It's function and form, hand in hand. So how do dentists actually make all this happen? Let's go ahead and open up the restoration toolkit, so to speak, and see what the most common tools are for rebuilding a smile. This gives you a great little snapshot of the main options. You've got crowns, which are there to protect a weak tooth. You've got bridges, which span the gap from a missing tooth. Implants are incredible. They replace the whole tooth, root and all. And of course, fillings for those pesky cavities. Each one has a very specific job to do. All right, let's zoom in on a couple of the most common solutions you'll find in that toolkit, starting with crowns and bridges. I really love this analogy. A crown is basically like a custom-made helmet for a tooth that's been cracked or weakened. And a bridge? Well, it does exactly what the name suggests. It bridges a gap, using the teeth on either side as anchors. Either way, the goal is the same. Get your teeth looking and working just like they're supposed to. The infamous root canal. I know, it has a pretty scary reputation, but when you actually break it down like this, it makes perfect sense. The whole point here is to save your natural tooth, not get rid of it. You just remove the infected stuff inside, clean it all out, and seal it up. It stops the pain and keeps the infection from getting any worse. So we've seen the what, the tools in the toolkit, but the how is just as important. How is this care actually delivered to make sure you, the patient, get the best possible results? A modern approach really stands on three pillars. First, everything's custom. Your treatment plan is made for you, because no two smiles are the same. Second, advanced tech. This means treatments that are often faster, way more comfortable, and more precise than they used to be. And finally, and this one is huge, an educational approach. This is all about making you a partner in your own care, so you can make smart choices. Now that we know what these procedures are and how they're done, let's talk about the most important part, the why. What's the real long-term payoff here? Because it's about so much more than just a pretty smile. This quote from the source just absolutely nails it. This stuff isn't about a temporary patch. It's about making a long-term investment in your overall health. And that investment starts right in your mouth. So when you put it all together, the results are things you can actually feel in your everyday life. This list, this isn't just a bunch of clinical terms. This is about being able to eat whatever you want again. It's about saving your natural teeth and preventing bigger issues. It's about the confidence to just smile without a second thought. These are real life-changing improvements. And that really brings us to the final thought here. We've talked about the what, the how, and the why. So the real question is a personal one. What could a stronger, healthier smile really mean for you? Something to think about. Thanks for joining us on The Explainer.